Hi, my name is Melissa Weitengruber, and I'm doing a presentation on the effects of exercise training on asthma. So the purpose of this study is to look at the various ways that having asthma can affect exercise training and its results, as well as if exercise training promotes the symptoms of asthma. So our goal here is to determine whether asthma has a negative effect on exercise or not. So asthma is also often referred to as bronchoconstriction because it constricts the airways. Asthma is a chronic inflammatory disease which makes it hard to breathe. The symptoms of an asthma attack include, but are not limited to, wheezing, coughing, pain, and shortness of breath. Asthma can occur in both males and females, and it occurs in people of all ages. It often affects people's sleep quality as well as their everyday activities, depending on the severity of the asthma. Some people only have mild cases of asthma to where it only happens occasionally and after things such as running a lot, and others have severe asthma to which it can affect them on a daily basis and affects their day. Regardless of the severity of the asthma, these symptoms are usually partly reversible with treatment. So here we have a picture of what your airways look like normally on the first one, in people with asthma in the second one, and during an actual asthma attack. As you can see, the normal airway in people with asthma, the smooth muscle is relaxed, and in the one with asthmatic airways. But when an asthma attack occurs, the smooth muscle tightens, which traps the air in the alveoli. Also, in an asthmatic airway, the wall tissue is inflamed and thickened. So there are many triggers that cause asthma. They vary person by person, and everyone has different allergy triggers, and some people have multiple triggers. These follow into multiple categories, such as exercise-induced triggers, which only happen when the person is participating in some kind of physical activity, occupational-induced triggers, which occur when the person has triggers around their workplace, such as specific chemicals where they work or something like that, and allergies-induced triggers, which occur when the person is around something they are allergic to. Some examples of these are pollen, dust mites, pet dander, smoke, respiratory infections, chemicals, some medications, stress, sulfites and preservatives in the food, and even cold air. So besides the typical triggers, there are many things that put you at risk for asthma. Having someone in your family that has asthma puts you at risk for having it as well. You're more likely to have asthma if a relative of yours has it. Also, if you're overweight, your chances of having asthma are increased. So inside the body, asthma is caused by an unregulated production of cytokines, IL-4 and IL-5, which are secreted by Th2 lymphocytes. The Th2 cells are inflammatory mediators, and they control the allergic response. These cells are regulated to the subepithelial fibrosis, mucus hypersecretion, and smooth muscle hypoplasia and hypertrophy. The inflammation resulting from asthma promotes airway remodeling. Studies have shown that about 41 million Americans have been diagnosed with asthma, and 16.2 million are affected by asthma symptoms on a daily basis. More severe cases of asthma can often result in long-term respiratory problems and often even death. There are many treatment options available for asthma patients, such as corticosteroids and leukotriene modifiers. The proper treatment is crucial in preventing short-term and long-term complications or health issues caused by asthma. There's a controversy that says exercise helps asthma, and some people say exercise causes asthma attacks, because if you have asthma and your airways are constricted, then exercising a lot affects the airways, which can cause an outbreak of asthma. But people also say if you keep exercising, you will improve your lung functions, which will eventually lead to less asthma attacks. So there have been multiple studies on that trying to prove the pros and cons of that. So asthma symptoms often interfere with your daily life in many individuals, which makes it difficult to perform normal tasks, which often results in people having a sedentary lifestyle. So this leads to the suggestion that exercise can help the treatment. Physical activity has been proven to have health benefits in regular healthy adults as well as in adults with asthma. So exercise training is known to enhance exercise capacity, reduce the negative effects of exertion, and even improve the quality of life in patients with lung disease. On the other hand, Exercise increases airway resistance, which can lead to exercise-induced asthma, or EIA. Due to this, many individuals choose not to take the risk of participating in vigorous exercise for fear of an exercise-induced asthma attack. The low levels of physical activity in individuals with asthma leads to lower cardiorespiratory fitness, which increases the chance of an asthma attack. It's like a never-ending cycle. So in response to this issue, physical training programs have been created specifically for patients with asthma. So, previous studies have shown that there is a relationship between sports and asthma, or more specifically, exercise-induced asthma, even though the study does not know if the asthma is induced by the type of sport or by the environmental factors that are included in the area in which the sport is being played, like the heat or the humidity. So, for instance, soccer or cross country are more demanding sports, which could cause more severe asthma attacks compared to less demanding activities such as jogging. Also, sports played in the outdoors, such as football, could have a more substantial effect on an individual than one played indoors, such as volleyball. In relation to this, swimming is often recommended to individuals with exercise-induced asthma because it improves the quality of the respiratory muscles, such as the diaphragm. It says that often swimming is recommended because the warm air outside helps the patients easier to help them breathe better in the humid and pollen-free air that is present directly over the water in swimming. So several reports show that there's variation between sports and asthma prevalence, and the variables that were considered include the type of sport, what type of environment the sport was performed in, and the length of exercise training per week. There was no relationship that was found between the exercise and asthma, but when the environmental factors were considered, the asthma reports were much higher in the individuals who played outdoor sports and exercise, but it didn't occur during the winter observation. So hot and humid environments were found to be more favorable by asthmatic subjects than low temperature, low humidity environments. And it was also concluded that the environmental conditions have more of an effect on respiratory symptoms than on the type exercise. So even so, physical activity in an aquatic environment can improve the exercise tolerance. We're also done to perform to see if Tai Chi Chuan, or TCC, improved nitric acid levels. It says the nitric acid is increased during asthma attack, and it's parallel to eosinophilia. And the participation in a 12-week Tai Chi Chuan exercise program showed significant improvement in the pulmonary function and levels of the exhaled nitric acid in the kids with asthma. Questions have arisen, such as whether or not the body mass index, or BMI, should be included in the study of exercise-related asthma, and if it's more severe in those individuals with higher BMI, or if it's an irrelevant factor. So the body mass index and lipid levels in overweight children with asthma and those without improved after they participated in Tai Chi Chuan, which tested to see if there was a relationship between BMI, aerobic performance, and asthma. Childhood asthma levels have increased over the previous years, and a similar rise was noticed in childhood obesity, with 1 in 3 children currently overweight. Previous epidemiological studies show that asthmatic children have a higher BMI than those of non-asthmatic children. Asthma significantly influenced the physical activity performance of children, and asthmatic children completed fewer activities than their non-asthmatic counterparts. So a study was done to demonstrate the serious health issues associated with poor cardiorespiratory function due to obesity and asthma. With every exercise comes risk factors, especially for individuals that have asthma. There was a study done that focused on the risk assessment and the clearance for physical activity in individuals with respiratory diseases such as chronic obstructive pulmonary disease and asthma, which are the 2 most common ones. So patients with asthma present many challenges for exercise specialists and physicians, which are responsible for assessing the risks and prescribing exercise to those individuals. So a physical activity readiness questionnaire, or a PARQ, P-A-R-Q, it's a tool which is used to determine if a person is ready to engage in a physical activity level beyond their current one. So there are different questions such as, has your doctor ever said that you have a heart condition? Do you feel pain in your chest when you do physical activity, etc.? And if a person answers yes to any of these questions, they must first consult with their physician before being allowed to participate in the program. So this readiness questionnaire helps physicians assess any medical concerns. And recent studies have proven that the PARQ is not the most effective way of determining if an individual is ready for exercise, and it often inhibits those who need the exercise the most from participating. Therefore, experts are trying to figure out how to revise the effectiveness of this PARQ test. So, the inflammation caused by asthma affects the structures of the airways, which increases the smooth muscle airway muscle mass and decreases the distance between the ASM and the epithelium. The ASM is the airway muscle mass. So, this is called airway remodeling. These have been done to determine if aerobic training could reverse this airway remodeling. And one of these studies looked at it and said the tissue injury from the inflammation that's induced by the mediators, which increases the fibroblast proliferation, said that after 7 days of the study, a decrease in the smooth muscle mass thickness was observed. The collagen fiber contents were reduced, and as well as the eosinophil migration. And then after 15 days, there was a complete reversal of the effects of airway remodeling. And then there was another study to see if airway remodeling could be prevented. So this study showed that an improved lung mechanics, the IL-4 and IL-3 were decreased, the transforming growth factor levels were decreased, and the smooth muscle mass and collagen fiber contents in the airway were decreased, as well as inflammation. So this all prevented asthma. So these studies proved that aerobic training could reverse airway remodeling effects as well as prevent them. So this is just a picture of the airway remodeling and the damage done by asthma on your airways. And it shows the chronic inflammation as well as all of the mucus buildup and the hyperplasia of the mucus glands. Also shows there's a bunch of collagen deposits in here and the degranulation and asthma. So exercise-induced asthma can occur in 80 to 90% of individuals that have asthma, and even 10% of people that do not have asthma can still experience it. So their study was done because there were a high amount of college athletes that reported having a high prevalence of exercise-induced asthma. It's often undiagnosed because a lot of people are not aware of it, and trainers and coaches do not preach it to their teams. So due to this, a lot of college athletes often disregard any symptoms that are exercise-induced asthma related, and they just see them as something minor and often just blame it on a poor training day, which results in unawareness and underlying causes of the disease. This is crucial because there was a 7-year study done at Becker which reported that 61 exercise-induced related deaths in college athletes were related to the practice and competition, and 81% of those were in athletes 21 years of age or younger. So these findings show that respiratory specialists need to stress the importance of exercise-induced asthma and its symptoms to college athletes and their trainers, coaches, and parents. The study suggests that college athletes are worried that exercise-induced bronchoconstriction is affecting their performance. So if I were to conduct a study to answer this question of if exercise training affects asthma, I would use both qualitative and quantitative analysis. I would use a large number of subjects. I'd use probably about like 300 participants of a wide variety. I would use both male and females aged 16 to 30, and I would have a control group versus a test group. And they would go through, the test group would go through an exercise program 4 days a week with moderate to mild intensity exercise for 12 months. Before the study begins, I would have each individual's maximum heart rate, BMI, cardiorespiratory fitness, and the number of weekly asthma attacks. I would record all this down at the beginning, at the 6-month period, and then at the 12-month mark. I would also give the individuals a self-assessment questionnaire to determine if they believe they have asthma or not. And then at the end of my subjects survey, I would do an informative asthma awareness course and teach